Hi everybody, welcome back to UWorld's Next Gen Nclex review session. We're so excited to have y'all here today. We're going to be doing an ECG question drill set. So if you guys have been here before, you kind of know the drill for these drill sets. We're going to go through 10 questions. We're going to, I'll read them, give y'all 30 seconds to answer, and then we're going to talk about why the right answer is right. These are really designed to just get as many questions in, do as much practice as possible, especially for all of you guys getting ready to take your Nclex. But I think I said my name, but my name is Jackie. We're glad to have y'all here. Make sure you guys are following us, and if you're on TikTok, share this session. The more the merrier. We want to reach as many nursing students as possible. So with that being said, use the chat. We want to see all your questions, all your comments. We have our content experts moderating the chat, so we will try and answer your questions the best we can. But we're so glad to have y'all here, and with that being said, we'll go ahead and pull up our first question. If you're just joining us now, we're doing 10 questions. We're focused on ECG strips, so we're going to walk through those for each of them, and we'll get started. All right, question 1. The nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing option 1, atrial fibrillation, option 2, ventricular fibrillation, option 3, ventricular tachycardia, option 4, sinus bradycardia. All right, let us know. Thanks to everyone who's following us on TikTok. We appreciate it. Let's see what answers you guys think. And let us know if you guys were here on Tuesday. In case you missed it, we did a whole session on ECG interpretations. So we followed the test plan that is available to all of you from the NCSBN. So we covered 5 dysrhythmias and the normal sinus rhythms. So check that out on demand on YouTube and Facebook. All of our videos are available there. So I'm seeing a ton of great answers come in. The chat is flying today. We love to see that. Our 30 seconds has probably passed, but I'll give you all about 5 more seconds as people are trickling in. As a reminder, we're doing ECG questions today. We have 10 and we are on number 1. And keep track of these as we go so you can let us know at the end how you did. Okay, so our correct answer is atrial fibrillation. So what you guys are seeing in this ECG strip is those fibrillatory atrial activity, so those P waves. They're glitchy. You can see that the atrium is a little bit glitchy, and we can see that our QRSs, because of that irregular atrium activity, our ventricle, when our beats are hitting, those are going to be irregular. So you're going to see that irregularly irregular rhythm. So that's how we know it's Afib. But you guys did so great on that one. I saw a lot of right answers, so well done. All right, let's move on. Question 2. We're doing ECG questions, and we are on question 2 of 10. We're glad to have y'all here. I will read it and give y'all 30 seconds. All right, the nurse is caring for a client who is short of breath and is experiencing the cardiac rhythm in the ECG strip shown below. Which of the following actions should the nurse take? Option 1, administer an IV fluid bolus. Option 2, prepare the client for synchronized cardioversion. Option 3, instruct the client to bear down. Option 4, prepare to administer IV push atropine. All right, let us know what you think. 30 seconds on the clock. What are you guys seeing? Bonus points if you can tell us not only the answer, but what you are seeing in the strip. So let us know. All right, good answers, you guys. Good job, good job. Let's see what you guys think. A lot of great answers coming in on Instagram. Good job, everyone, on YouTube. We have a lot of people on today. We're glad to see you guys. Again, if you're on TikTok, make sure you guys share this session. And for everybody, follow us on your favorite social media channel. We'll have our schedule of all of these lives that we're doing available for you guys on there. A lot of great content as well. So, all right, let's see what you guys are seeing. All right, I will go ahead and pull up the right answer. Okay, so the correct answer is option 4, prepare to administer IV push atropine. Okay, so what you guys are seeing in this ECG strip is bradycardia. So we need to give medication that's going to increase our heart rate, especially because our client is symptomatic. They're short of breath. So that is going to be our right answer. IV fluid bolus, that would be something we would give for tachycardia. Think about like low fluid volume. I saw a little bit of mix of answers, so we'll kind of go through these. Synchronized cardioversion, that's something we can give for other dysrhythmias like Afib or stable V-Tach. And then instructing the client to bear down, that is not going to be correct for our client. So, all right. That would be for SVT is what we would instruct our client to do for that. Okay. All right, question 3. Good job, you guys. Okay. The nurse is caring for a client who is experiencing the cardiac rhythm in the strip shown below. The nurse should recognize that the client is experiencing option 1, ventricular tachycardia, option 2, atrial fibrillation, option 3, ventricular fibrillation, option 4, sinus bradycardia. All right, what are you guys seeing? Let us know in the chat. A lot of good answers coming in. You guys are asking how long the strips are. So you guys will either see strips in 10 seconds or 6 seconds, and what we have today are 10-second strips. All right. Good job, you guys. Let us know. And this, how we're structuring these questions, this is typically how they would be presented to you on the Nclex. So know when you're seeing questions here from UWorld, that's what we're all about. We're helping you prepare for the Nclex, taking a lot of that guesswork away. So this is how you would see it on the test. All right, good job, you guys. Okay, I'll give y'all about 5 more seconds, but I'm seeing a lot of good answers come in. You guys are definitely familiar with this one. All right, okay. So our correct answer is ventricular tachycardia. So what you guys are seeing is the ventricle is taking over as the pacemaker of our heart in this situation. So we're seeing just ventricular activity, just the QRS complexes, a lot of R waves. So we have an extremely high heart rate happening here, and we have a widened QRS. So we talked about on Tuesday, our QRS complex should be less than 3 squares. QRS is 3 letters. So think of those 3 small kind of ticks. So what we're seeing here are widened QRS complexes and no atrial activity. So that's how we know it's V-Tach. But you guys did great. Good work. All right. Again, a reminder for anyone who's just joining us, we're glad to have y'all here. We're going through 10 ECG questions. I read them to you guys. You have 30 seconds to answer, then we talk about the right answers. So, all right, let's move on. Question 4. The nurse is observing continuous cardiac monitoring for assigned clients. Which of the following cardiac rhythms would require immediate follow-up? All right, so nothing to read here about our options, but you guys can see 4 strips, so we'll talk about those. And y'all have 30 seconds. Let us know. And let us know, too, after you answer, what rhythm, or what is the rhythm in the option, if that makes sense. Thanks again, everyone on TikTok for following us. We really appreciate it. You guys are doing awesome. All right. Cool. Okay. Give y'all just a little bit more time. Very good, very good. All right. Okay, so our correct answer is option 4. So again, what you guys are seeing in that option is V-Fib. We know we need to defib V-Fib, so that's why it's requiring immediate intervention or immediate follow-up. So what you guys are seeing in, I think most of you guys got this one, but I will walk through these in case you all have any questions. So what you're seeing in option 1 is a flutter. What you're seeing in option 2 is sinus tachycardia. So you're seeing all the essential elements of an ECG strip, but just quicker. And then option 3, you're seeing premature atrial contractions, so that atrium firing at the wrong time. And then again, option 4, V-Fib. So essentially that's our heart activity kind of unraveling. Our ventricles are quivering or fibrillating. So that is a life-threatening dysrhythmia, and we need to take immediate action for that one. Okay, again, so many people following and sharing us on TikTok. We really appreciate it. Thank you all so much. All right, pulling up the next question. Question 5. Again, if you're just joining us, we're doing ECG strips. We're on question 5 of 10, halfway marker. All right, let's do it. Okay. So the nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing option 1, V-Tach, option 2, V-Fib, option 3, bradycardia, option 4, Afib. Let us know what you guys think. What are you seeing? What are you seeing? Good job, you guys. A lot of good answers coming in. Thanks to everyone joining us on Instagram. Good to see everybody today, and YouTube. Y'all are doing awesome. And as we're at this halfway marker too, let us know when you guys are taking the Nclex. We'd love to see that, help shout you out, wish you luck. And if you've passed your Nclex, let us know that too. That's amazing. I know a lot of people are kind of in the thick of it right now, so keep us posted. And also let us know when you're starting your jobs too. You're kind of right at that point where all of that's coming to a close. So. All right. Oh, tomorrow. Rio, good luck. You'll do great. We're glad to have you here. Hopefully we can get you some last-minute ECG knowledge. Okay, so what you guys are seeing on that strip is ventricular fibrillation. We just talked about this in the question before. But that ventricle, that heart activity, it's unraveling. This is life-threatening. We need to defibrillate this client immediately. So you're only seeing ventricular activity, and there's really no distinction of what's going on. So it's chaos, and that's how you know it's V-Fib. All right, good job. Okay, good luck, everyone, taking your test coming up. Good job, everyone. Okay. Question 6, halfway marker. Let us know, too, how you guys are doing out of the first 5 questions. Okay, the nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing atrial fibrillation. Option 1, atrial fibrillation. Option 2, sinus bradycardia. Option 3, ventricular fibrillation. Option 4, ventricular tachycardia. All right, let us know what you think. Good job. Good answers coming in. Again, this is a 10-second strip. Let us know what you think that means for this answer. Good job, you guys. A lot of good answers coming in. And as always, we want you guys to know we have a 7-day free trial available on nursing.uworld.com. We encourage you to check it out. You'll have access to tons of great questions, lecture videos, NGN-type questions, case studies, everything you need to pass your Nclex on your first try. So make sure you guys check it out, and we hope it can be helpful for you, and we know it can be helpful for you. All right, it's been really fun to see you guys come back and let us know that you've passed your Nclex too, and especially passed it on 85 questions. That's amazing. So we want to be part of your studying journey here. Okay. All right, let's pull up our right answer. So what you guys are seeing is sinus bradycardia. So we have all the essential components of our ECG strip. So we have a 1-to-1 ratio of P waves to QRS complexes. Our QRS is going to be less than the 3 squares. Our PR interval is going to be around 5 squares. So that's what we're looking for. Again, if you this 10-second strip, if you are to multiply this, your heart rate out, we're going to be less than that 60 to 100. So that's how we know it's sinus bradycardia. But otherwise, it's a very regular strip. It's just slow. So we think about like problems with our SA node, problems kind of generating our electrical activity in our heart. So good job, you guys. Okay, let's see what we got. Question 7. And again, it's not too late to share this session for anybody joining us on TikTok. Again, we want to reach as many of y'all as possible. Okay, the nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. Which of the following medications should the nurse expect to be prescribed to the client, or for the client? Option 1, epinephrine. Option 2, atropine. Option 3, rivaroxaban. Option 4, lisinopril. Let us know. Again, thanks everyone on TikTok for following us and sharing this session. We appreciate it. Good work, everybody. All right, good answers coming in. What do we know about this dysrhythmia? So this is kind of like a 2-step thinking process question. You have to be able to identify what you're seeing and then know expected treatment for these clients. So I'm seeing a lot of good answers come in. Good job, you guys. I'll give y'all about 10 more seconds and we'll pull our answer up. Is anybody really loving ECG strips? Like, do you feel like anyone here wants to maybe be a tele nurse? Or do like ICU where you're really having to be in tune with these dysrhythmias? That's awesome. Seeing a lot of good answers come in. Good job, you guys. Okay, All right, let's pull up our answer. So our correct answer is rivaroxaban. So again, this dysrhythmia that you're seeing, this is Afib. What we know about Afib is our atria are quivering and our blood is swirling. It's not moving as cleanly and as quickly as it normally should. So with that swirling blood, we can have clots develop, especially in the little appendage that's in our atrium. So that clot can dislodge and travel up to our brain, causes stroke. So that's why clients with Afib need to be on anticoagulants. So that is what we see with rivaroxaban there. So good job, you guys. Good answers. Well done. Thanks, everyone, for following us and for sharing this session. All right, question 8. Almost there. The nurse is, the nurse is caring for a client who's experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing option 1, atrial flutter, option 2, atrial fibrillation, option 3, premature atrial contractions, option 4, premature ventricular contractions. All right, let us know what you're seeing. Let us know what your answer is. 30 seconds on the clock. Let's see what you guys think. Let's see what you think. Good answers coming in. Seeing a good mix of things so we can spend a little bit more time on this one. But y'all are doing great. Good answers. Good job on YouTube and Facebook. Good work, everyone, on Instagram, too. We love seeing the chat go as fast as it's going. Good job, you guys. All right. I'll give y'all about 5 more seconds. Good job. Good answers. Okay. So what you guys are seeing is premature ventricular contractions, or PVCs. So what we can see, especially with our QRSs, is that they are distorted. That QRS is too wide. So again, QRS is 3 letters. It should be less than 3 boxes. So we're seeing a wide distorted QRS complexes, and we're also seeing irregular rhythms. So, somewhere after the SA node, our ventricle is firing inappropriately. So too fast at the wrong time. So, 1 PVC is okay, and it's to be expected maybe if we have a little bit of ventricular irritability or something that's kind of agitating our heart. But when these become 3 or more, we worry about our client going into V-Tach, and when we have V-Tach, we worry about V-Fib, and we know V-Fib is a lethal dysrhythmia, and we need to defibrillate that client. So that's why we need to know PVCs. We need to watch them. We need to monitor them. We need to make sure they're not increasing in frequency. So good work, you guys. I saw a lot of right answers on that one. Okay, let's pull up our next one. Question 9. We're in the home stretch. We're on question 9 to 10. All right, so the nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. Which of the following actions should the nurse take? Option 1, continue to monitor the client. Option 2, prepare the client for synchronized cardioversion. Option 3, request a prescription for amiodarone. Option 4, instruct the client to perform the Valsalva maneuver. All right, 30 seconds. Let us know what you think. Good job, you guys. Good answers coming in. And I'll just use this time, too, before we end. Next week, I'll kind of go over our schedule for you guys. But on Tuesday, we will be on all of our social media channels live at noon Central Time. We're going to be doing a content overview on HIV. Then on Wednesday and Thursday, we will be live at 3 p.m. on TikTok and Instagram. And so we will be doing question drill sets on oncology and then infection-related questions. So you can see us on all of our channels Tuesday at noon, and then Wednesday and Thursday. Find us at 3 p.m. on TikTok and Instagram. So we look forward to seeing y'all there, and we'll be doing more of these question drill sets. And we love to know, too, what topics you want to see. We're always listening, and that's really why we did all these ECG questions. That was the people asked, and we delivered. So, okay. Pull up our answer. So what you guys are seeing is normal sinus rhythm. So we're just going to monitor the client. Nothing to do here. Maybe this was a little bit of a trick question, but it's important that you guys can recognize normal sinus rhythm. So again, we have a 1-to-1 ratio of atrial activity to ventricular activity. So our P wave and our QRS, it's 1-to-1. In this strip, our rhythm, our rate, we're within 60 to 100. And we have that 1-to-1 ratio of P waves to QRS complexes. Everything's within its range. We have a three box QRS wave and a 5-box PR intervals. So good job, you guys. Okay, I saw a lot of good answers on that one. Well done. I'm glad we couldn't trick you. Okay, question 10, last one. Thanks for being with us. The nurse is caring for a hemodynamically stable client who is experiencing the cardiac rhythm in the ECG strip shown below. Which of the following actions should the nurse take? Option 1, prepare to administer amiodarone. Option 2, prepare the client for immediate defibrillation. Option 3, continue to monitor the client. Option 4, request a prescription for digoxin. All right, let us know what you think. Let us know. Good work. Good answers. All right. Let's see what you think. 30 seconds. I'm seeing a good mix of both of these, so of answers. Again, not too late to follow us. Oh, here, you guys are going fast. Let's see what y'all think. All right. Tricky. This was a little bit of a trickier one, but we'll walk through it together. All right, I will pull up our answers. So our correct answer is option 1, prepare to administer amiodarone. So again, what we are seeing in this strip is V-Tach, and our client is stable. So we're not going to defibrillate a stable client with a pulse. Again, we defibrillate when we don't have a pulse, pulseless dysrhythmias. So we are going to give antidysrhythmics like amiodarone, trying to reset the heart. And then we do need to take action, though. We're not going to just continue to monitor this client because we know V-Tach can transition into V-Fib. And then digoxin, V-Tach can be a side effect of dig toxicity, so we definitely don't want to do that. All right, good job, you guys. Let us know how you did out of the 10 questions. This was awesome. I saw a question here. How do you know it's stable? It's in this question we said they're stable, so kind of have to put some of the clues together of what the question is saying and also what you're seeing in the strip. So good job, you guys. Well done. As always, we encourage y'all to check out our website at nursing.uworld.com. We have our 7-day free trial. We hope you guys will come back and see us next week. We have a lot of great content we're going to be covering. And as always, let us know if you have any suggestions for topics you'd like to see covered. We're always listening. Follow us on your favorite channel, and we will see you guys next week. Have a great weekend. Bye.